Okay, so this is basically, we're going to talk about all of the various different blood conditions. You have this chart at home, right?
Yeah.
Okay. All right, so basically, we're looking here at the top left corner. We've got the protein linkage, and you can see the lemon-shaped guys in the middle there, and these are an indication of low hydrochloric acid in the daily diet. And the fix is a very simple, just adding the pancreatin into the diet. Usually the Digest is the one that I recommend, the one from CNC. Next one here is the rouleau. We've already talked about this in depth, but basically it has to do with low oxygen levels and low oxygen and low water levels. Usually dehydration is an issue as well, and changing the pH in the body is always something I would recommend at this level. Next one here, we've got the erythrocyte aggregation. Now this is what I always refer to as heart attack blood. That anytime somebody comes to me, the blood looks like this, and they have fasted for 6 hours, first thing I do is make sure that my sample was correct. It was not my fault. And if in fact the blood does look like this is usually a smoker or somebody that is just a stroke looking for a place to happen. And then you pull out all the guns and you give them everything you got. You just got to sell these people up the yin-yang, because they will not live very long with blood that looks like that. Over here we've got what's called target cells here. And this is actually referred to as hyperchromate in the other books. Basically it's low B12 folic acid and iron, and you can see the arrow pointing there. You can see the dimple in the center of the cells. Going one below it, we've got the ovocytes here. Now again, this is always an indication of nutritional imbalance. Usually has to do with the B12 deficiency, and the oval ones, obviously they speak for themselves. Next here we've got the aniocytosis. Again, imbalance. All red blood cells should be the same. Should be round, 7 millionths of an inch. 7 microns, I guess was the word I was looking for. And what you're seeing here is a various different shapes and sizes that's exacerbated again by the nutritional deficiency. Over here, a macrocyte. Macrocytes are generally a little bit bigger, again brought on by imbalance of the B12 folic acid and iron combination. Beside it, we have the microcyte, again smaller than 7 millionth of an inch, again brought on by nutritional deficiency, and B12 folic acid and iron are always the culprits. The echinocytes, which basically is free radical damage here. You can tell by the lumpy, bumpy things on them. And generally I'd be looking for some kind of a as a supplement, rather, I'd be looking for something that would reduce the free radical damage in the body. I'm a big believer in the vitamin O2 and just general nutritional supplementation, but massive nutritional supplementation. This one here is the acanthocytes. Again, it's just a cousin of the echinocytes. Again, nutritional deficiency, free radical damage, and generally over here the polygonocytes, same family. Over here we have chylus. Chylus this is a very poor picture. Chylus is the name that we give to the little white dots that represent the fat floating in the blood for somebody who has had the blood taken without fasting. The chylus is the name of the white fat floating around in the blood. And you'll see them sometimes in clouds as well. They float around like just a cloud floating through the blood. Directly below it here, we're looking at the spicules. Spicules, again, heavy protein that has not been filtered out of the blood by the liver. Liver is the sewage treatment plant for the body, and liver cleanse is always number one. Again, here we've got normal blood in the center, individual, separate, round, all the same size, no bumps, no clumps, no stacking. Generally, when you see blood this good, congratulate them, shake their hand, and ask them what they do. What's your secret? Up here we've got thrombocyte aggregation. Thrombocyte aggregation, the blood platelets, and generally is an indication of stroke risk. Always put them on the arterial cleanse formula. Chelation is a winner. And directly below it we have uric acid. Now the uric acid is produced in the kidneys. You can tell them because they're very mirror-like shiny. They're almost hard to see. You have to reduce the light in the microscope to see them. That's how you would differentiate the difference between the cholesterol crystals and the uric acid crystals, is that the uric acid is always going to look like a piece of a broken mirror. You reduce the light, you can see them, and you'll notice that they actually have a slightly different shape. The cholesterol crystals, which are right here, are generally a slightly trapezoid and more square. They're not quite as point and sharp as the uric acid. Directly below you have the hypersegmented neutrophil. 4 segments, 4 black segments is ideal. 3 is an indication the person has got a real problem. 5 is an indication they are sick beyond belief. 4 indicates, doesn't matter what else is going on in the body has not degenerated to any point that would be cause these hypersegmented neutrophils to increase to the 5 or reduce to the 3. Here we have neutrophil viability. Now basically this is a picture of a neutrophil, and the viability refers to the movement and the granular activity that you will see in the center of them. And with the neutrophils, you'll notice that they stream. They sort of, like the movie The Blob, they just sort of go in the least path of resistance. Beside it here we have a black and white, a gray and white photo of a red crystal. Red crystals show up as red under the dark field, come in various different sizes, from little tiny things to really big things. If there's a lot, you've got somebody who's a significant heart attack risk. Generally it's brought on, but it's actomyosin mixing with cholesterol creates the crystal, and it's as a result of a histamine response. But it always is a red flashing light in terms of the client's cardiovascular risk. I would always ask them, especially depending on their age, if they're below 40, I would say that it's genetic for sure. And always impress upon the client they need to pay attention to these things. Here we have plaque. Shows up as little tiny patches, sometimes big blobs. Obviously the plaque lines the arteries and can cause all kinds of problems. I'm a big believer in the chelation. I like the EDTA. You can also use the RTRE, the nutritional protocols, and there's a variety of other things as well. But anytime that you're getting involved with plaque that would look like this, you've got somebody that knows mom and dad had problems, and or the doctors will already have them on medication. Directly below we've got monocytes, and you can see down here, these are your the regulatory white blood cells. They're the good guys. Are very much, I use them as the analogy would be the police. They basically are there to keep the peace. They let you know that everything's okay. If there's no killer cells or no excessive neutrophils or hypersegmented, would indicate that all is well. Here we have the eosinophils, again, a white blood cell. Here we've got the basophils. You'll find that they generally show up. They're generally a light blue under the dark field, and they're generally brought on as a histamine reaction, generally related to either allergies or an allergy to an environmental toxin. Lymphocytes over here. I can't even see them in there. And directly below we've got L forms. Now these photographs are looking really, really chintzy, but the L forms are these little tiny things you see in the background. Again, the remedy, of course, would be to just simply liver bowel oxygen, go right back to the 5-step to radiant health, clean up the liver, increase the nutrition, get the bowels working, increase the oxygen. Over here, your rod forms. Basically, it's a little tiny, it looks like a parasite. It's a 4th level of degeneration of the 13th stage of polymorphic development. And they're an indication of pH imbalance, and